Good morning. For the first time, poisoning deaths are now the leading cause of death for ages 15 to 24, with the majority of those linked to fentanyl. In fact, according to the CDC, more younger people are dying from overdoses instead of what used to be car crashes. The growing problem here in the metro with fentanyl coming up. Good morning. It is Monday, May 23rd. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Coming up, it's the first day of our new Proton Center, offering a new treatment for those with certain types of cancers. We'll test your Proton knowledge coming up later in the show. In about 15, Dr. Dana Hawkinson joins us, shares the latest COVID numbers and COVID headlines. And young children and teens dying from drug overdoses, largely due to fentanyl. As summer looms, kids are bored and parents are concerned. What law enforcement is doing to help stop this growing problem. So get your questions sent in to us on YouTube, Facebook, and you can email us at the Medical News Network. You can find links to all of those right there on your screen. In headlines this morning, it is a big day for the University of Kansas Cancer Center. Today, the first 2 patients will undergo cancer treatment in the region's first and only proton therapy center. The clock is counting down as our first pediatric patient prepares to get their treatment. 2 adult patients will follow soon after. The Proton Center has been 3 years in the making. This treatment is especially effective to treat brain tumors, ocular tumors, as well as tumors in the chest and abdomen, basically any place where precious other organs and tissues are nearby. The targeted beam is tissue sparing, which makes it an especially good option for young patients, for pediatric cancer patients. So our patients today are grateful Proton is now closer to home. The sign on this $66 million project was officially revealed last month at the Cancer Center. This was an exciting day for us, but today is even more rewarding to know that we are reaching out and helping bring proton therapy to the region. Coming up, we want you to take part in our interactive quiz to test your proton therapy knowledge. So get ready. We're going to put you and Dr. Hawkinson and all of our guests to the test. Well, the numbers tell the story as we turn now to a major issue affecting our kids, teens, and young adults. In Kansas City alone, there were 129 overdoses in 2021. 50 were fentanyl related, an increase of 150% from 2019 to 2020. In KCK, there have been 57 overdoses compared to 34 at this time last year. On the Missouri side, in Clay County, the issue is so severe, the Sheriff's Department is holding meetings for the community. So sounding the alarm this morning is Dr. Mitchell Douglas, Medical Director, the University of Kansas Health System's Marillac campus, and Dr. Elizabeth Silver. She is Managing Director of the Poison Control Center at the University of Kansas Health System. And also joining us virtually, Clay County Sheriff Office Sergeant Gary Blackwell. So glad to have all 3 of you with us this morning. Hi.
Good morning.
Good morning to you. Not sometimes when you and I get together, it's to talk about things we don't like to talk about, and it's usually not great news, but we're going to kind of break this down. It's not just fentanyl, though. Last week, 4 Platte County teens took over-the-counter medication for a recreational high. So I want to start with you, Sheriff Blackwell, about what types of over-the-counter products are kids into now? Is it the same old, same old? What's new? What's out there? What do parents need to know? Oh, I think you're muted.
As far as,
there you go.
am I on now?
You are on.
Okay. It's pretty much the same old as we're finding now. You know, it's the typical kids will do anything to chase a high, and they tend to pay attention to what they can learn on the internet. And and that's what it was in Platte County, as I understand. It was just over-the-counter prescriptions that they took in an overdose, in an overdose amount to try to get a high. And fortunately, and I say this, it's kind of sad that you have to say fortunately it wasn't anything stronger, but this is just it's the trend right now, and it's a trend we're trying to combat.
So I want to talk more about fentanyl and have you help us understand more of what it is and how to look out for it. But when we talk about over-the-counter, I mean, I think we go back into our high school age. I remember Robitussin cough syrup was the thing back when I was in high school. Do those things change over time, Sheriff? Is there something new? I mean, help educate us so parents know what to, if they see something in their kid's bag or backpack or in their room, is there something that is super easy access, like over-the-counter medication, that they should know about?
And it's over-the-counter medication, and parents know their children, and they know what they should have and what they shouldn't have. And if they know that they've given their child Robitussin or something like that to combat an ailment or an illness that they have, then they could understand them having it. From what I understand, though, with schools now, you don't bring in any over-the-counter stuff without checking it in with the nurse. But it comes back to, and I don't mean to sound crass in it, but it comes back into parents need to parent, and look at what their children have. Look through their backpacks, look through their phone to see who they're contacting. That's the way you're going to find out this type of stuff. And I don't mean to run parents down or anything like that. What I'm saying is the days of the involved parent is more essential now than ever.
Really well said. Dr. Silver, what are you seeing as far as phone calls to the Poison Control Center? Anything over the counter that parents need to be thinking about?
Yeah, so we definitely see a different trend in some of these over-the-counter overdoses. TikTok is a great example of what continually keeps us on our toes. There was a Benadryl challenge a while back. Benadryl is a common over-the-counter medication that can cause a lot of severe toxicity when taken in higher amounts than normally prescribed or what's recommended. Robitussin, as you kind of suggested, still very common. So a lot of those over-the-counter medications that teens can get high from, we are still seeing them utilized today, and the internet sort of just compiles that and makes it more likely, especially when there's trends surrounding it.
Dr. Douglas, what are you hearing from your patients?
I mean, unfortunately, what I'm seeing is that there's such a strong culture now of distribution of drugs, especially in schools, of distribution of people taking pills. But because those medications now are being laced with fentanyl, a very strong, powerful opiate, 50 times more powerful than morphine, 100 times more powerful than heroin, that we are seeing them very quickly getting addicted to these medications. And when they're taking those pills, they don't know what's in them. Mm-hmm. They think they bought a Xanax, and it's not Xanax. It's Xanax plus fentanyl. And then the way they take it, they're either addicted or they can overdose and die.
So where are they getting the pills, and then where are the people who are giving them pills getting the fentanyl to lace it with? Help us track it.
So my understanding, we got the police officer right here, is that these very easy to illegally manufacture these medications, and then the drug distributors are putting them in other medicines to make them look like a different pill. And I see kids coming in and they think they're taking Perks, but they're not taking Perks. So when they check it, it's not Percocet. A straight opiate is laced with fentanyl. And the kids are coming in, by the time we get to my inpatient facility, they're extremely addicted, having very severe withdrawal symptoms.
Sergeant?
We've seen fentanyl, we've seen marijuana laced with fentanyl. Marijuana that kids are buying off the street that's got fentanyl in it. What I have found is that there's a lot of students, there's a lot of kids, there's a lot of young adults that know that they are getting fentanyl. It's the only drug to where if I sell somebody a pill that kills them, then suddenly all the rest of their friends are wanting to know where they got it from, because they know that in this instance that I would have strong stuff. And we find a lot of children now that straight up know that they're getting fentanyl and seek the fentanyl out. We've had some overdose deaths where they thought that they were getting maybe Xanax or maybe Percocet, and found out that they were laced with fentanyl. But we've also had as many deaths where they knew they were actively seeking fentanyl-laced tablets.
So I'm going to play the role of the naive parent, because I think, Sergeant, like you said, you're not coming down on parents. There's just a lot we don't know, and there's a lot to keep track of, and we think the best of our kids, and we want to give them a lot of power to make good choices. So what you're telling me is that the point of having these laced with fentanyl is to get them addicted. Is that what you're saying? Keep them coming back
Correct.
For more?
And it's cheap. We're finding as much in even heroin by any other standards, the heroin alone would be junk heroin. It would be very low quality heroin, and then they're lacing the heroin with fentanyl because fentanyl is A, so easy to obtain, and B, so cheap in the long run that they can lace all other sorts of narcotics with with fentanyl to get people. Make no mistake about it. It's 100% about getting someone hooked, and it's 100% about money. That's what it's about.
Not about our kids, not about their health.
It,
What is fentanyl? Explain to people if they're not familiar exactly. We know it's a bad drug, but what is it? What makes it so incredibly dangerous?
well, there are doctors that could describe it better than I can, but it's from what I understand, it's a synthetic opioid that, like we say, is extremely powerful. It's way more powerful than heroin or morphine. Like I say, as far as the side of it that we're looking at, is they're obtaining it usually on the dark web from China. It's going to the cartels, and the cartels are pressing it in tablets that are made to look like Oxy or made to look like Percocet, and then bringing them across the border. And then and we could have local pill presses. We've heard that there are local organizations, drug trafficking organizations that have it in the Kansas City metro area and basically every city in the United States, and then are pressing these pills and selling them. As far as the medical definition of fentanyl, that would be something that would be better directed towards a medical professional than I.
I'm gonna bring I'll bring Dr. Silver in to help you with that part of it. So what's happening in our body when fentanyl, what is it, what's happening to our body, and talk us through the overdose process and what's happening.
Absolutely. So as was stated, fentanyl is a synthetic opioid, so it is man-made. It's not directly derived from that poppy plant that most of the opioids, like morphine, are directly derived from. And it works as an opioid agonist. So we have several different types of opioid receptors in our body. And the whole point of it is to, at least from a prescription standpoint, help with pain, right? We see a lot of different opioids that help with relieving pain, but there are other things that those receptors do. So it's not just able to only target the pain. You get other side effects, typically being CNS and respiratory depression. And when I say that, I mean difficulty with your breathing, so that typically slows down, potentially stops, and then you also have patients that get sleepy, pass out, have a coma. Pinpoint pupils is the other common side effect that we see that typically cues us into an opioid overdose. So if you have a patient who is completely unresponsive on the ground, they're not breathing, pinpoint pupils, that's your triad for an opioid overdose. And I do just want to say there is a distinction between fentanyl that we use in the hospital every single day and the illicit fentanyl that we're seeing out. So there are different types of fentanyl. Basically, there's fentanyl that we see every single day with patients coming in for trauma, and they get some fentanyl for pain. There's patches, patients with long-term pain, like cancer patients. And then if you change the structure just a little bit, you have a fentanyl analog. And so you see things like furanyl fentanyl or acetyl fentanyl. Carfentanil are really common, and so they're actually even more potent. So their structure is modified a little bit, even more potent, which means you need less of it to actually overdose and have those effects.
I want to talk to both of you about numbers. Dr. Silver, I want to stay with you because I want to know what kind of calls you're getting to the poison control. We know that's an anonymous place for people to call, so it's a safe spot. Are you getting calls? What kind and what age groups?
Great question. So we do get actually quite a few calls about illicit fentanyl overdoses. I will say, since we are voluntary, we don't have the numbers compared to what Sergeant Blackwell is seeing, for example, out in the field every day. So I can say in 2020, for example, we had 43 specific to illicit fentanyl that we suspected or that were called to us that were suspected. We jumped to 73 in 2021, and we are already well on track to stay pretty similar to last year. The majority of those calls are in ages 13 to 30. That is, over half of those calls are in that age group, teens being the largest age group for that. And so one of the common things we're seeing is perk 30s. That is the most common, sometimes Oxy 30, oxycodone 30, but perk 30 or Percocet 30 is like the name for fentanyl that we're seeing called in or suspected that they're taking, which there is no Percocet 30 prescribed. Percocet is a combination of oxycodone and acetaminophen, and so Percocet 30 is not actually a dosage that you can get for Percocet.
You're kind of shaking your head, Doc. What's up?
That's really was for me about a year ago, what we started to see that the clue being something different was going on. Because I saw kids coming in more and more, and we got their substance abuse history, and they'd be like, oh, yeah, Sometimes I take Percocets. What are you taking? Oh, Perc 30s. I'm like, that's not a dose of Percocet. And it's sometimes now it sounds like the kids know, and I'm hearing about that too. Oftentimes the kids didn't know. And so I want to make sure really just a clear message, because I want to watch my time, letting the family members know when you're checking on your kids, checking their bags is okay, making sure they're having an open conversation about drugs, but really having that same conversation that you're having about car driving. The former leading cause of death in this age group, which is you're going to not drive drunk. If you're drunk, you're going to call me. We're going to make sure, you're going to wear a seatbelt, because that keeps you alive. Right now, no fault of the kids, there are a bunch of drugs being handed out. Their drugs are in the school, people are buying them, they're going back and forth, and the kids need to know you can't trust what that drug is. And so for those kids who are they're not addicted, they're not seeking it, but they think it's going to be okay just to take one pill, oh, it's probably a Benadryl, or it's going to be a Xanax. You don't know. The odds are, when I just looked at the data from CDC, they're showing a 42% rate of those things being laced. So really having this is big stuff, that really hard message to the families, that strong message to the kids. You can't be buying pills in school.
But why are kids turning to pills? Why would I just don't again, my only reference is,
I think it's the
30 years ago when I was in high
anything,
school.
it's the economics too.
So
because
why?
fentanyl is so cheap to make. It's not a poppy field that has to be grown in growth. They can take fentanyl, make it in a lab, and stick it
But
in
are
there.
kids taking it because of depression, anxiety? Is it peer pressure? What are you hearing from the kids that come into Marillac?
So again, Marillac's an inpatient child psych hospital. I oftentimes have that conversation with kids where they're coming in after an overdose, near lethal. Fortunately, they get to be seen by medical professionals in an ICU setting, and they're alive. And they'll make a statement to me like, well, I've been having some rough times, and I just wanted to get high, but I didn't want to die. And my response is always, the pills don't care about your intent. When you take the pill's going to do what you do, which is either going to survive or you're going to die. And so we really have to kind of change that dialogue about, the intent behind the overdose. You overdosed, and now, fortunately you survived, but maybe won't be so fortunate next time.
Is there a certain area or problem that is getting better in some areas but getting worse in others? You talk about the pills. Is there something though that we're seeing the needle move in some areas, but then we're seeing kind of a backtrack in others? The pills are higher.
Yes.
The age group is changing.
Age group is a little younger. I think the community's response is getting much better, looking at great action from our police force, trying to really combat this in a very serious way. From my standpoint, we've really been now reaching out much more to our addiction specialists. Been at Marillac for 7 years now. Before, we weren't doing that much specific outpatient addiction work. We've been really trying to partner with our addiction specialists and make sure these kids, I got really young kids who are now on pretty intensive substance abuse treatment.
Youngest kid?
12, 13.
12 or 13.
Younger.
Youngest kid that's called in that you could recall?
For intentional, 13.
Or unintentional,
12, 13.
Yeah.
That's the age. We unfortunately had a fatality from 2 years ago of a 13-year-old with an intentional self-harm ingestion. And just this morning I was looking for fentanyl specifically. Last year there was a 17-year-old that was called in. That was a fatality for us, which we don't get as many fatalities as sometimes in the field is seen, but we take that to heart.
Are we have a chance to talk about Narcan?
We will, yes. But you absolutely, we're going to talk about that. But you mentioned something about the community, reaching out in the community, and the police departments,
yes.
sheriff's departments doing such a really good job. And I wanted to talk with Sergeant Blackwell because you all have started meeting with the community about this epidemic. What have you specifically been doing? What's been the feedback?
We've specifically just been trying to target and from shall I say, a cafeteria style approach with what we call the drug summits. And there's parents that don't need to know what the signs of opiate use are, what the signs of fentanyl use are. They need to know they know that their child is hooked on these. I mean, we've seen people that have been smoking, and there again, with the paraphernalia that may be seen, tinfoil where they've been smoking pills. I guarantee you that none of you have ever seen a prescription that says smoke 8 pills a day. It's the method of use that tips them off first, but they know what the signs and symptoms of opiate abuse are. They need to know where to take their child to get treatment. We cannot incarcerate every user It's not our intention to put everyone in jail or prison or federal prison. The right people need to go to prison. So what we're trying to get down at the community level, at the parent level, at the friend level, and talk about the signs and symptoms of opiate addiction and abuse, and steer those people towards treatment before we have to run an overdose death investigation that involves them, or before we have to show up at their house, on a search warrant. We talked about the age of the average user. It hasn't been that long ago. We drug a 14-year-old girl out of a dryer during the execution of a search warrant. She was in the dryer with tinfoil to smoke tablets on, with a lighter and with tablets, and hadn't been in school in 2 years. Juvenile system had been looking for her for 6 months because she'd fallen off the radar. That's a success story so far. They got this girl into rehab, and we actually saw her last week, and she's doing much better. Those are the victories that we're after. It's easy to put people in prison. It's harder to get people sober. And so we're going at it from that aspect, especially with the young children.
Hardcore grassroots efforts.
Correct.
Sergeant, so I was just going to ask you, coming up, we're going to be talking about a dollar test that can determine if something has been laced with fentanyl. Is there any way to tell if something has been laced? Is there a smell? Is there a look that
Not
might
without
tip
a test.
someone off?
For the professional, or for those that are trained, we can generally look at, and when it first started, we could look at these tablets and we'd say that's a fake tablet. But what they're getting now is so much higher quality that a lot of times it's hard to tell. I've had people say that when they used it, they could tell if it had fentanyl in it because it tasted different. The problem with it is that you can't taste it until you use it.
Yeah.
So no one really knows what they're getting until
It's too
they
late.
either come through or not.
So I have a community question that came in that was similar to something we've talked about, but Rob wants to know, Dr. Douglas, maybe you could talk about this, but what has been the biggest challenge reaching kids these days versus maybe 20, 30 years ago? We know the problem is still there, but the way we reach them, is it different? Just as society changes, as kids change, as there are new challenges to raising a kid these days.
Yeah, I do think the thing, Dr. Silver brought up regarding social media, certainly we need to be looking at TikTok, looking at, if our kids can spend 2 to 4 to 8 hours a day on a certain platform, that's where they're getting their information, that's where they're talking with their friends, that's probably where we should be trying to get information about what their information they're receiving around drug culture. That'd be one big challenge I think we're facing, making sure, when I'm doing psychiatry, making sure part of their gathering a social media history is a part of the psychiatric assessment. It's been a tough couple of years. You say 20 or 30 years. I'm saying the last 2 or 3 years. It's been crazy. Kids were in school, then they weren't in school at all, then we expect them to go right back, and then we tell them they're safe, then we tell them not safe, wear a mask, don't wear a mask. It's been crazy.
Yeah.
And I could see, we hear that, they're like, maybe I'll go back to school, maybe I'm not.
And I remember you saying throughout this last couple of years, one of the best news you could hear is that kids are getting back to class because they're getting so much good support there, but they're also getting a lot of bad stuff.
Some bad stuff too.
Yeah.
Yeah.
With the good comes the bad.
Yep.
So table this for just a quick moment. We're going to turn to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. We want to get an update on our COVID count this morning on a Monday morning. Good morning.
Yeah, that's a hard segue to make to this conversation from this extremely vital conversation that we were just in. And to Dr. Douglas's point, these last 2 to 3 years actually feel like 5 years in so many respects. But right now for COVID here, cases in the health system continues to look very good. 4 active cases, 0 in the ICU or on the ventilator, 4 in that recovery period. And overall, cases are slowly trending up in the United States. Hospitalizations slowly trending up, but not to that extent that we're seeing. So overall, this continues to be good news.
A couple questions about COVID this morning. A clue that COVID is deadlier for men, that estrogen may play a role, like a protective role for women. What are we hearing about that?
Yeah, I think early on we had always somewhat seen some more of a preponderance of male fatalities or more severe disease, maybe being more at risk compared to women or females. So I think that is Now we are starting to look into these things. We've also heard other things about genetic factors. There were things about blood cell type, but that really never panned out. But I think it is important to now delve into these genetic factors and see what does raise your risk. And certainly it seems like there may be this partially protective effect. Again, it's not the end-all be-all. These are things taken in degrees. This is maybe one more degree that we can say that, well, maybe that's why we haven't seen the deaths or the severe disease in the preponderance that we've seen in males that we've seen with females. So.
And then the CDC is saying that COVID hospitalizations are on the rise again in most states. True?
Yeah, that is true. That is true. But again, not to the extent that we saw in the Delta Omicron period or previous to that as well. So overall, this continues to be a very good trend. But yes, as the weeks go by, we have seen a slight increase in the weekly hospitalizations.
All right, we're going to check back with you in just a few moments with some community questions. But if you're joining us this morning, we are talking about the growing fentanyl drug overdose issue really everywhere. Dr. Mitchell Douglas, child psychologist here at the psychiatrist here at the health system. He's the medical director at our Marillac campus. Dr. Elizabeth Silver, managing director of the Poison Control Center at the University of Kansas Health System. And also joining us is Sergeant Gary Blackwell. He is with the Clay County Sheriff's Office. So we are glad to have all three of you here. Great panel, very important discussion. And let's talk about any other stories that you can share, Dr. Blackwell, Sheriff Blackwell, about what you're seeing out on the streets, just to help parents understand. We love it when you come on because you keep it real and you really are great at educating us on what parents are supposed to be looking for.
And it's like anything else. A big thing is monitoring their social media, monitor who they're talking to, monitor what's in their backpack. What really has me scared is now that our tablets that we're seeing, Xanax, we're seeing ones that are purported, oxy. What I'm worried about is what happens when they make them look like Bayer aspirin. That is a giant fear for me when it comes to interdiction and when it comes to other things that as law enforcement we're looking at trying to take these off the street. But it's looking for the paraphernalia. It's looking for the straw that's burnt. That's burnt on the end. It's about 3 inches long, and it's normally burnt on the end from the heat from people smoking pills. It's looking for pieces of tinfoil that have a black mark tracing all around it in just a random pattern or several of those. It's looking for the signs that the abuse has taken place in the first place. It's monitoring their overall condition. Whether they're completely coherent as they should be. And it comes back to just knowing your children or knowing your friends, knowing your siblings, what is different about them now, and that tells so much. As a parent myself, I have 3 kids. Luckily, they're all older now. I would hate, and my heart goes out to parents of today. With just one more worry to worry about.
Yeah, that's you make a good point though. Just pointing out the specific things that parents need to be looking for. That they may look at one little thing and not really be able to put all those pieces together, but to start to put the pieces of the puzzle together to see if everything adds up. It's just really, really important. Talk about that test. There's a paper test, a cheap dollar test that you can tell, a strip, if something has been laced with fentanyl. How do people get a hold of that? Or can parents get a hold of that?
As far as people actually getting a hold of it now, I hear that they're out. I don't know of a specific direction of which to go to now to get it. We've been hearing they're out. We know that a lot of users are talking about hoping that they can get a hold of the tests, so at least they can determine whether they're using, whether they're using actual prescription medication or whether they're using something that's laced with fentanyl. And it's what I tell everybody is if you get something from a pharmacy, you have absolutely no worries. You have no worries if you obtain your prescription that was issued by a doctor from a legitimate pharmacy, then you have no concerns. So if you are prescribed this medication, feel comfortable in taking it as prescribed for the time period that's prescribed. When you go to buying your narcotics off the street, is when you have a much greater chance of running across medication that's been tampered with.
Dr. Douglas, this might be a conversation that's a little off base or maybe a whole other show, but we've talked about the mental health issues during COVID. Do you think that this has contributed to the fact that kids can't get prescribed medication or haven't gotten the mental health help that they've maybe sought or haven't been able to get in touch with during this time? So now they're going and finding pills or finding things to help ease their anxiety or depression. Do you think that has helped or added to the problem that they haven't been able to get the help that they needed? Or does one just never know?
One doesn't really know. I think there's probably lots of factors at play right now with regards to this unfortunate increase in rate of kids dying from fentanyl overdoses and other overdoses. You know, I think one of the things I'd like to really focus on, especially though, is that there are things that can be done to get things better. I mean, Sergeant mentioned, like, you know, incarceration is not always the answer. We are looking to get, you know, when kids get addicted, we want to get them in for treatment. Really proud to work at a medical center, which has a really good addiction center, one of the oldest treatment for addiction center in the country. And they've really had to expand the age group that they see. I've been working with them for the past year or so, and they're now seeing kids as young as 15, which is not normally what they were doing before.
They've had to back up their age.
I know. They said, listen, this is where the need is. So
let's talk about Narcan. Tell people what it is, how it works, both of you, please.
So naloxone is an opioid, we say antagonist. It basically inhibits that opioid receptor that fentanyl, oxycodone, morphine, all of those opioids work on. Naloxone will inhibit that. And so that is basically our antidote. That is what we use to reverse these effects. It will wake people up. It sometimes also, if you're giving them too much, puts them into withdrawal, and then they have those effects if that's something that they've routinely used. But it will save their life. It will help them to start breathing again, to wake up, regain consciousness. And so naloxone is absolutely number one. Everyone should have it. If you are suspicious that a friend, family member is at risk of overdosing. And it is available from pharmacies in the state of Kansas without a prescription for free.
Something people might not have known. Tell us more.
I just want to make sure people, that's such a big message. So if you're concerned that your child or family member may have any risk of having an opiate overdose, you see the child or the person, they appear to be non-responsive, certainly, and you're there's a concern of it being an opiate overdose, calling 911, administrate naloxone, stay with the person, try to get them to wake up. If they do revive, you're still calling 911 because that naloxone doesn't suddenly solve the problem. They need to go to the hospital. They need to get emergency treatment.
So you're
that's saving lives.
So Narcan is something that if you think someone in your family, especially if your child, is struggling
with substance abuse,
you can go to the pharmacy. You can ask for it. So it's over the counter, if you will, through the pharmacy.
Through the pharmacist. So the Kansas Board of Pharmacy has a protocol that they allow pharmacists to sign. So it is pharmacist specific, not pharmacy specific. But any pharmacist can sign that. That does not require a prescription from a physician. And if you say that you know someone who's at risk, or school nurses, law enforcement, any first responders, you can go to that pharmacist, ask for naloxone, and they will give it to you. It is free of charge. You can actually Google that, go to Kansas Board of Pharmacy pharmacist naloxone, and they actually have a map to show which pharmacists and what areas have signed that protocol, so you can actually find a pharmacist who can dispense it.
Wow, that's important information.
Yeah, it is.
Sergeant, how does Narcan fit into the work you're doing and the help that you're doing in your community?
It's a large part right now, and there's a lot of people who think that it's a cure, and it's not a cure. And the way I describe it is, it's to bring somebody out that you can get them to more advanced medical treatment. But we've had schools. We had a school that was a lot of the schools around here are now successful in having Narcan at their school. We had a school that got their Narcan on a Monday after going through quite a process to get it. Got their Narcan on a Monday, and by Wednesday they'd already administered it to a student that was in school. We've had deputies save lives in casinos, on a traffic stop where they found a car along the side of the road with Narcan, and it's really a very valuable tool for law enforcement and for basically anyone that's out there. And that's something that I've always told parents and told families that had anyone that was taking opiates, whether prescribed or not, have some Narcan in the house, because when you need it now. You don't have time to go to a pharmacy and get it and go through that process. You need it now. And we've had some success in that. Like I say, one of our success stories was actually Narcan 5 times the week prior to them being arrested. 5 times they had overdosed, which is scary. The disadvantage to it, I'd say, if there is a disadvantage to it, is that people become dependent on it. And you get 2 people that are chronic users, and it's smart the way they look at it, but no 2 people get high at the same time. That way there's somebody there to administer Narcan if need be, to bring somebody in and out of an overdose. So you balance it between being a crutch in order to use more and being a true lifesaver. If given the choice between Narcan or no Narcan, then I choose Narcan every time. But people need to use it for what it's for and not use it to enable them to use more and take a chance on overdosing.
And you touched exactly what I was thinking before you got to that point of that double-edged sword. And are addicts able to get a hold of it? How can they just go to the pharmacy and there's no way to tell if somebody has an issue? I mean, that's got to be kind of scary. But again, it's doing far more good than bad.
Yes.
I understand that. But
dead,
again,
not dead.
I
I'm gonna
told
choose not
dead,
dead.
not dead. And I told you, that's why I said, I'm trying to think through the parent eyes.
So something that we do at the Poison Center is and we've been telling our poison specialists, who are the frontline people who answer the phone, is if we have a patient who, whether it's fentanyl or not, if they come in from an opioid overdose or any suspicion of that and they require naloxone, before their discharge, we try to tell the nurses, if we catch them in time, give that patient naloxone before they go home. That's just, it's something so small, but something we're trying to make that impact with, so that even the patient who comes in from that overdose, they have naloxone going out. It doesn't fix the problem. I think expanding medication-assisted therapy and other treatments for opioid use disorder are going to ultimately be the overall arching way to sort of solve some of these problems. But if at least we can give that person naloxone, or that can go with their friends or family when they're being discharged, is something else we try to do.
Well, I asked earlier in the show, I said, what is one of the things that's different from maybe back when I was in high school 30 years ago? That would be a very big difference. Like you said, dead versus alive. That's all that matters. I'm going to get to a couple of community questions this morning. Isaac has a question. Sheriff Blackwell, this one's for you. Have there been any instances of drugs being hidden inside food at restaurants or school cafeterias? He says, I just wouldn't be surprised if something like that could happen or would happen. Just your thoughts.
And that type of stuff I would expect to see that happen. That goes along with the old adage of the term that we use in narcotics enforcement called dead drops. Somebody leaves a certain narcotic at an area and then walks away from it, and then someone else goes and gets it and leaves the money behind. I mean, that would be a typical of something that we would see, and it would not surprise me a bit. But there again, as far as specifically planting it there for an unsuspecting person, I don't see that happening. But 2 people transferring either the cash or the narcotics, or both, at a location where the 2 people aren't there at the same time is it's common.
Yeah, anything's possible. Is there a similar
Yes.
availability in Missouri for the Narcan as it is on Kansas? Same process?
I believe it is available. My husband's a pharmacist and practices in Missouri, and so he knows that he's able to dispense it, but I don't know the laws and regulations quite as in-depth as I know for Kansas.
We've been talking a lot locally here about helping curb the problem, working together as a community on a grassroots, small level. What is it looking like on a federal level? Anything you could add to that about what you're hearing just in a larger scope?
I'm pretty much sort of boots on the ground, go
Yeah,
to my
I know
hospital,
you
see
are.
the kids, and like what we got today.
Yeah.
I do know there's lots more of initiatives coming from the federal level, I think it's being much more recognized by the federal government, all the major medical bodies, that this is the crisis now.
Yeah.
This is what we're dealing with. I would like to kind of reframe it too. You mentioned to start this that we're seeing these overdose deaths are now higher than kids who are dying from car crashes. Well, that's from 2 trends. One, this is going up. the car crash deaths are going down. I was just looking at that data. So these are all, that's what makes this conversation so frustrating. We're talking about preventable deaths of young people. These are modifiable, these kids
Two
are
types of deaths that are
can
preventable.
be stopped. Yes, kids don't have to die in car crashes. And now we figured out, hey, don't drive drunk. Hey, wear a seatbelt. Hey, let's try to figure out how to make cars safer so if an accident does occur, there are things like airbags that can deploy so you don't, die. Similarly, these are preventable deaths. Kids don't have to be popping pills that have fentanyl laced with them. They don't have to be popping pills at all. So this curve can change. That's just a really big challenge for the next 12 months to see if we can get this curve to change from going up to back down where it needs to be.
All right, we're going to get to some final thoughts from all of our guests today. Sergeant, let's start with you. What do you want this community to know? And you can lay it on hard if you want.
Okay, and here's we talk about preventable deaths. 42% of all tablets, that are laced with fentanyl, 42% have a potentially lethal dose of fentanyl in there. And when you frame it like this, and I've had a lot of people tell me don't frame it like this because I am by no means endorsing playing Russian roulette. You have a better chance of living through Russian roulette than you do of taking with 42%. If you have 1 in 6 on a revolver, then that's talking 16.6666%. And when I heard that 42% of tablets that are laced with fentanyl have a potentially lethal dose of fentanyl, and I stopped to think, I said, you have a better chance of living through playing a game of Russian roulette than you do of living through extended use of fentanyl or even one tablet of fentanyl. If you're going to use or even one tablet that contains fentanyl with 42% of them containing a lethal dose, that's pretty scary statistics right there. And it's something that is very easy for a young person to comprehend, the fact that, and I tell people this, there were, a lot of people that didn't want me to say that, but it really sinks it in that you have absolutely a better chance of living through Russian roulette than you do of taking that one tablet that's laced with fentanyl.
Well, thank you for saying what wasn't supposed to be said, because I think we hear you loud and clear. Sergeant, thank you so much for being with us as always. You're welcome back anytime to talk about this.
Thank you.
Dr. Silver, just a message to our community where they can get help, where they can go, who they can call.
Yes, so I'm going to say first, Poison Center is available 24/7, 365 days a year. We are 1-800-222-1222. We are non-judgmental. We refer patients in when it's appropriate. Hospitals call us for help depending on what the overdose is, including other opioid and fentanyl overdoses, and also knowing what those symptoms are. So your triad of pinpoint pupils, CNS depression, which is basically unconsciousness, comatose, extremely sleepy and unresponsive, and then respiratory depression of just decreased breathing or stopping breathing. Those are your triad of symptoms for opioid overdose, and naloxone is available. Please get naloxone from your pharmacist to use if you need it.
Dr. Silver, thank you. And Dr. Douglas, I know this is your heart and soul. You're working with one child at a time. As you said, boots on the ground. You walk in every day to tackle today's problem and today's child. Just want to give you kind of a moment to speak and let us know what is important to walk away with today.
So it kind of makes me sad that over the past kind of 12 to 24 months, it's really changed from, a couple of years ago, kid came into the inpatient psych hospital. I'm worried that when they leave the facility, I want to make sure they don't die by suicide. I mean, that's my job. I want to keep them alive and want to decrease the risk that they're going to die by their own means. And now it really has been added to our list of things I need to really think about for every child that comes through my facility. I want to make sure that they're safe in the home from others. I want to make sure they're safe to themselves. And then I want to make sure that they're safe in terms that I've done everything I can to decrease the risk that they're going to die by overdose. We've added our ability to consult with addictions. We hand out Narcan a lot at our facility now. So if there's any indication at all, Narcan is now on our discharge paperwork. This is a big deal, people. So give your kids a hug, talk to them, enjoy them, figure out what's going on. If you need help, come on down, get some help.
Thank you so much. Dr. Hawkinson, final thoughts from you today.
Yeah, it's just echoing what Dr. Douglas said. It's so vitally important, it's not like, and we've heard these stories, and maybe you did that when you were growing up as a child, in high school or whatever. There's a lot of peer pressure, drinking some alcohol, having a few beers, or smoking a cigarette. This is not what that is. It's so vitally important to have those open conversations with your teens to let them know that, number one, be careful, it's not safe, but also just to be able to talk with you and be honest about that thing. So I don't think we can emphasize those points enough. So
All right.
that,
Well
probably
said.
done. Yeah.
Thank you. Well, you are not done, actually.
All right.
Because it is test time for you. So we want to know who has been listening and following along for the past several years as our new Proton Therapy Center came to life. Dr. Hawkinson, have you been
Several
listening?
years.
Okay, paid attention?
Yeah.
Because it hasn't been all COVID. We've been talking about this fantastic center, and we have question number 1, and we want everyone at home to kind of play along. There's just 3 quick questions. See if you know them, and we'll give you the right answers. So the first question, with the opening of the University of Kansas Cancer Center's Proton Therapy Center, how many Proton Therapy Centers are currently open in the United States? Okay, question 2, approximately how many patients in the United States have already been treated with proton therapy? We are welcoming our first patients today, but how many already? Third question, what is the average length of outpatient proton therapy treatments? So those are your 3 questions. Let us know. I'm going to see if anybody has them, but I am totally going to put Dr. Hawkinson on the spot. But guess what? I'm going to let you read the answers, and I know you're going to get them all right. So,
Well,
Okay.
I've been here and listening. You know.
I know you have.
It seems
well,
again.
let's just see. Let's see if our guests know.
Oh boy.
Do you know?
And you have every excuse not to know the answers, just because you guys have been pretty busy doing other things. But
I feel like 6 is very dramatic if it's only 6 in the
you
country.
think
Yeah.
you think it's 6 or not? So
I think it's B. That's
you
my
think
guess.
it's B 6.
I go C 39.
You go 39. Dr. Hawkinson, what do you say?
I'll say C.
C is right. Okay.
Yay!
Say. Okay. What's the
Oh, God
ding
dang.
ding? Okay, that's a good sign. That's a good game show sign. What's our next one? Okay. Approximately how many patients in the United States have been treated with proton therapy?
Hawkinson probably knows. What's your guess?
I went first last time.
Oh, sorry. I'm going to guess it's not that many because it's a pretty, it's a little bit of a rare treatment, a great option that we have available here at KU. 27,000 K Medical Center.
That's what I said. What did you say, Hawk?
I'll say C.
You'll say C. What do you say?
I was thinking C.
Okay, it's C.
Because I had to up it from my 6. I was going to do 27,000 if it was only 6.
There you go. Okay, so we all
Right,
got.
39.
there you go.
Good. Okay, so we all have to get one wrong. That's
Okay.
it. Okay, so good. We've all checked the box. Okay, let's get our last one in
boy.
there. So, what is the average length of outpatient proton therapy treatment?
Like, how long are you in the tube?
Just like how long
Zip, zip,
could
zip.
it be?
I mean, it'd
Can
be
it do
nice
it?
if it was B.
I mean, that'd be amazing.
That would
5
awesome.
to 10 minutes? That'd be, but that seems unrealistic.
Okay, Hawk, what do you got?
I got.
I'll go
gonna say-
A.
I'm going to say A.
I like
I'll follow
A.
our guest.
I've got A too. A?
Yay!
Okay.
That's gonna be quick.
I was like,
2
where's our
out of
ding,
3
ding,
isn't
ding?
bad.
Hey.
Okay, guys, we did pretty darn good. So, all right, very cool.
What?
Well, that's the best.
Oh,
Is that how we start out our Monday? Great.
It's like every Monday. That's what
It is.
sounds
That's
like.
just that's the sound of Mondays around here, everyone. Okay, thank you so much for being with us today and playing along. Don't forget you can catch our shows anytime by logging on to Facebook, YouTube, and Twitter. Go out and make it a great Monday. We'll see you back here at 8 a.m. And as we leave you now, we want to show you inside the Proton Center and the international renowned medical professionals who are all part of it and make it happen.
The promise of hope is a pencil-thin beam of light called proton therapy.
Our powerhouse team of internationally renowned experts understands this complex cancer care.
As a physicist, I tailor a safe, efficient proton beam to target your specific cancer.
As a dosimetrist, I apply the appropriate proton dosage to kill the cancer cells.
As your nurse navigator, I'll guide you through every step of your treatment journey from the moment you call.
You can trust your care plan is personalized to treat your specific cancer.
The University of Kansas Cancer Center is the only NCI-designated cancer center in Kansas and one of 71 in the country.
Patients treated at NCI-designated cancer centers have a 25% greater chance of survival compared to other cancer centers.
Specialized care, expert treatment, empowering hope in a pencil-thin beam.
Proton therapy at the University of Kansas Cancer Center you can trust our care.
Coming up tomorrow on the Morning Medical Update, COVID cases are on the rise once again in the metro. In fact, one county is seeing a positivity rate in double digits. I'm Jessica Lovell. So will you need to mask up again? We dig into the numbers Tuesday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.